I'm going to be presenting from a dentist point of view. I've been a practitioner for many, many years, also involved in academics. Um, we tend to lag a little bit behind medicine in some of our things. This is good because it gives us a chance to see where you might have misstepped a little bit or whatever, or led the way, both sides. But it puts us in a unique position. I think the other thing that's really unique is you all think about dentistry as like what's in the mouth, like 32 teeth. How much problem can that be? Well, it can be a big problem. Um, and we're gonna go through a couple different things. Thank you, Mary. So the last thing is how I look at everything is how does it affect my profession first, because we have an obligation to our profession, and then how does it change my day-to-day practice? Okay, we can go ahead and go through this. We're going to zip through a couple of these slides pretty quickly. So our objectives obviously are to understand what AI is, how it can affect us, what it can improve, what creates problems for us, and then understanding the ethical and legal considerations, which I know will be talked about in depth later on in this symposium. Okie dokie, Mary. So we're going to look at, I know this is kind of like, what does this have to do with it? But I think if we think about this, always keep this in the back of our mind because it should drive every decision that we make, not only from a practice management point of view, but how we interact with our profession and the other professions, medicine, law, all the other professions. Okay, Mary, thank you. So we're going to I'll have her slide through these. And again, it's just to bring back to our forefront, like, what is our charge? What did we sign up to do? And how are we going to do it? And how are we going to make sure the people that follow us, because we're not going to be here forever, how are they going to be able to take the information we have and move it forward to better care for our patients? And Mary, there's several slides here. You don't need to, you can hesitate on them for a second, but we're not going to go through them in depth. These slides, I believe, will be available after the symposium to the participants. But under dental ethics, we have obviously you do as well in medicine, do no harm and informed consent. And what is involved with that? Patients have the right to do with their body as they choose. But it's our job to inform them properly to take care of things. So next. So this is kind of interesting because the model rules of professional conduct are a little bit different for the lawyer, and this isn't a group of attorneys, but they're going to look at things a little bit differently than a healthcare provider is going to look at. So just keep that in mind as we move forward. And next. So what is our goal? Our goal is to improve the health of patients worldwide. We know that the dentistry is a huge contributor to lost days at work, lost causes of insurance payments. Luckily, not in the grand numbers of things like a cancer patient would, but toothaches can really be very dangerous and very expensive if they get out of hand, but mostly they're just inconvenient. Next. Go ahead, Mary. And so this comes on a legal concept of patients are allowed to determine what they want to. In this case, the hospital ended up being found liable for also mishandling a patient. And go ahead forward, Mary. So this actually brings about this case in 1957, the basic concepts of informed consent, which is going to become really relevant when we look at artificial intelligence. Next. Okay, so what do we need? We need a clear understanding of what's going on to make a diagnosis and to recommend treatment. We have to provide those options to the patient, what we think is the best course of treatment, but also what no treatment would involve, and if there's alternatives to treatment. And we base that on obviously on our clinical knowledge, on images that for dentistry almost always is based on radiology, imaging techniques, and a clinical evaluation. We don't do much in the blood work evaluation and things like that. But we always are aware that we can misdiagnose and treat the wrong problem. Next. So what does artificial intelligence bring to us? Well, it's not a new concept. It started actually back in the 30s, and it was going kind of great guns in the 50s, and then we couldn't keep up with things, so it kind of went dormant for a while, and now it's back in full force. So we're going to look at the things that have become really in the forefront of artificial intelligence. Next. And this one and the next several slides, you've already been over, but it's just going to trace the early days of AI into now the convolutional neural networks and what's coming on the forefront. Our goal is to predict with accuracy what we're seeing so we can inform our patients. So Mary, you can actually skip through the next couple. They're just different visuals of how things work. And again, the next one. Okay, so this is kind of interesting. I was really excited. We got a invitation to prepare comments for a draft by the ADA for the standards. All of our standards are federally regulated. And I was really quite excited because the UK is about 10 years ahead of us in our regulatory arena with artificial intelligence. And I was like, oh, okay, well, this is great. Here we go. We have a draft. So I opened the draft and it is about 47 pages, if I'm not mistaken, of nomenclature. And I was really quite disappointed at first because I wanted to read more. But then I realized we have to have an agreement on where our nomenclature is coming from and what it actually involves. So if anybody is actually interested in reading that, you would go to the ADA/standards/ANSI, ANSI. That's who's putting it together. But by the fact that we're just now doing a draft of nomenclature, you can see we really have quite a long ways to go before things are built on all the different possibilities. Next. So we're going to look at what are we looking at in dentistry? And I find when I work with my doctors, they have a very nice general view of how the oral cavity comes into play, but they don't have a very specific view of care. And that's to be expected. They shouldn't have to have that, but it does come into play when we're trying to work across these aisles of, is this an oral cancer or is this just a lesion? Is this something that's benign? So we do have to be able to talk to one another. And then we have to be able, with our information, to provide with the patient with a best estimate of what their care is going to involve and what the predicted outcome of their specific treatment will be. Okay, next. So what we're going to do is we're going to start with each subspecialty of dentistry. For those of you that aren't familiar, endodontics is my specialty. It is the root canal, the blood and nerve supply of the tooth. We first saw this, and we can look at this as an early AI implementation, if you were to think of it that way. Vertucci came up with classification of anatomy by looking at thousands and thousands and thousands of teeth and slicing them like every millimeter from the coronal portion of the tooth down to the apex, and then saying, okay, we have these 8 classifications. Teeth are going to fall into one of them almost always, with very, very few. And that held true and is still true when we work with our residents. This is still the seminal article on anatomy of teeth. But can we do better? And of course we can. These are all 2-dimensional, sliced, looking at them, and then someone sitting there digitizing everything. Next. Mary. So this would be an image on the left of what I would see as an endodontist. And I'm going to be looking at, oh, is there something here that would guide me to propose to my patient that they might need a root canal? And so when we apply an AI subset to this image, for dentistry, a lot of them are pretty in 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 their infancy. So we're just going to color code these teeth. And then we're going to say, okay, this kind of cream color is a filling, the green color is dentin, the purple color is enamel, the inside of the tooth is the pulp chamber. And we can see from it that, okay, it might be a little bit occluded by calcification. The filling is a little bit deep, and yes, there might be a need for a root canal. We also, where this little red box is, the teeth are numbered, this number 3, there might be a carious lesion. This is probably one of the areas that artificial intelligence has been very good at predicting, especially if it's interproximal between two teeth. It's not as accurate if the lesion is on the facial or cheek side or the lingual or tongue side. It doesn't have that discrimination. So we're going to look at that as we move on. Next, please. So this is another really exciting area where oral surgery can be very important. And that's just predicting if we move the mandible in a certain direction, what do we do to the facial changes? And while this is an aesthetic concern, it's also functionally very important. But even more so now, I've had the opportunity to work with some of the individuals that are in the military, and they are presenting, or not only in the military, but at the VA where we have cancer patients where they've had, part of their mandible resected. What can we do to bring them back to a normal physiologic, aesthetic result? Can we refabricate a jaw? Can we, put back a temporal plate because somebody got injured in a war environment? So oral surgery, there are our go-to in the head and neck region. Plastics also has a lot of important input into this, but this is a really nice application. It's visual. On the top, you can actually see how the mandible has been brought forward. It improves our functionality as we masticate and chew. And aesthetically, it's a more appealing look for us. Now, that being said, we know that culturally, different cultures visualize aesthetic beauty in different ways. And that's going to become one of our problems when we're putting this data in. Go ahead to the next slide, please. So ortho is probably one of the earliest people that use this. For those of you that aren't familiar with orthodontics, it's how we move the teeth to get into perfect occlusion. And we have like, I don't know, 30 or 40 points that we mark on a lateral ceph radiograph. And then we draw all these angles and lines. And this is why I'm not an orthodontist, to figure out how we're going to move the teeth, or if we need to do, orthognathic surgery in addition. So this was early on. This was in the 1920s, that they've been using this model for a long time. Next slide, please. And this is what this would look like. This one is actually done by AI. And you can imagine how much quicker this is than sitting with a view box, putting the ceph on it, and then marking all these little dots, and then drawing the angles, then measuring the angles, then taking the model impressions and moving, cutting the teeth individually and then moving them to where we want them. So we can get so much quicker and so much more accurate if we're doing this using artificial intelligence. Next, please. In pathology, again, this is an area, we don't have a lot of oral pathologists. We send a lot of our stuff to regular medical pathologists. And so we have to rely on them to be very aware of what's available to the dentist and how we take our biopsies, how we send them off. It's always a fight with residents, particularly why we want to submit pathology for them to evaluate, because you never know what you're going to get. And luckily in dentistry, we don't have a lot of bad news very often. And so people get lazy and they don't send it off. And so there's things that we can do ahead of time that might be able to give us a better insight into what we should be looking at. And this comes into play a lot of times with sinus issues. Like, is it a dental issue? Is it an ENT issue? Is it benign? Is it, malignant? And what do we want to go after? What do we want to try to biopsy? So pathology plays a large part, but we see it kind of downstream, not so much in our diagnostic portion of care for our patients. Okay, and go ahead and slide to the next one. In pediatric dentistry, this is a totally different application of AI than we would normally think of. The pediatric dentists are how to manage patients. How do we take care of our little ones? How do we keep them still? How do we get them engaged in brushing their teeth? And so pediatric dentistry has taken AI to a whole different avenue source. And they're looking at what can we do to distract the patient? What can we do to entertain them while we're working on them? And so they're coming up with a lot of games, augmented reality, virtual reality, the glasses that patients are wearing so they can see and not worry so much about what's going on in their mouth. So they've got a little bit different slant. Go ahead, next slide, please. And you can see here from this thing, child caries is a huge problem. And again, a lot of missed days of school. We know that missed days of school then end up translating into poor performance, and that just sets them on a not very good path. And then supernumerary teeth. Again, we would see this in early screening in pediatric dentistry, but also it's primarily probably picked up in the orthodontic arena. And then we have all these little areas that slice our pie. Next, please. Perio is another area where we look at AI and it's very valuable. But one of the problems, again, is we don't have that three-dimensional component. We're not taking three-dimensional scans just to assess periodontal pockets. And so if you go to the next slide, we'll be able to see there's separate levels of bone depending on if your X-ray beam is going exactly 90 degrees through the bone, or if it's angled either in an anterior posterior position, it's going to change these measurements. And that has been a big problem for the periodontal community because we can't reproduce in the same accuracy that you can on an MRI for where your head is stabilized and your beam radiation source is stabilized. And so we have a lot of work here. And what happens when we have this problem is we get bad data. And from 5th grade science, if you put bad data in, you're going to get bad data out. And usually every step along the way magnifies the bad data that's going to come out. So we've got to figure out a way to stabilize our patients and our X-ray source. And one way to do that is to take cone beams on all of our patients, but that's really not indicated if we look at the oral radiology standards and the white page paper. That's not an indication. So we've got a lot of work to do in this arena. How do we make sure from one appointment to the next that we've got exactly the same measurements? How do we then translate that into we're improving their care, we're making progress, or not? Next, please. Prosthodontics, again, this hasn't been a really hotbed of excitement until we got into the implant placement and restoring the implants. And so they've got a lot of things that they're looking at. They scan a lot of things, but they're more looking visually at what kind of space do I have? Can I get a prosthetic device in that space? And their data set is very small. It's very limited. that specialty is a relatively small specialty. So the data that's coming in, again, it's going to take us years before we can say we have solid data to build our programs on. Next. So this is a nice representation of, in the upper left, we want to replace that tooth. Do we have enough bone? Is it the right quality of bone? Is it the right density? And so AI can be very valuable in that sense. Next. So, and then we have all these little ancillary things. Forensic dentistry, how do we use AI identifying individuals through remains? And this is becoming more and more important. That was an area I wanted to do my master's thesis on in mass disasters. I was actually told that's foolish. We'll never have a natural disaster that you would need to know this for. Then we fast forward many years to Katrina, some of the military conflicts, and there is a lot of room for forensic dentistry. Our public health, we're using all this information to develop health policies. And what are the social implications? Can we get to these people that was mentioned earlier by Dr. Sambar that are in, remote areas? How do we take care of those patients? And then research. What's our place in research? Do we have a place of research? And how do we translate that into care? Next slide, please. So here are some of the things that I see as a clinician and an educator. We have problems because we have this invisible bias. A lot of the algorithms that are prepared in the UK, European countries, or the US. And so we have a lot of countries which could have different values in the global South and in the Latin American countries. And if we look at one of the biggest studies was the cardiac study years ago that came out and said, here are the symptoms of a heart attack. Problem is all that data was on males. We find out many years later that, oh, females have a totally different presentation, oftentimes, not always. Our downstream issues relate to the accuracy and relevance of the algorithms. And again, this comes back to what's going in and who's putting it in. I can tell you, being a program director, sadly, I have residents that, they may misdiagnose something or click the wrong box. And then that data is going into a larger data set. And for any of you that are involved with Epic, I had to kind of smile to myself when they were saying the medical records can be shown alongside of the imaging. That has not been my success story, not to call out Epic, because I think this is a universal problem. We don't have good talking between programs. So next slide. And then we look at everybody that's got a stakeholder in this, and they all have different values and import. So our regulatory issues are trying to keep our patients safe. Our insurance companies are trying to be profitable. Our researchers are trying to create data that is solid enough that we can predict health conditions, how to treat them, and the prognosis. Then we have our academic institutions that need to teach our upcoming practitioners. And what are they going to use? Are they going to use AI models? Are they going to use dimensional practices for their exams? Dentistry used to have live patients that we did all of our procedures on. That's going away now to more not AI driven yet, but it's certainly going in that direction. And then our providers, they kind of fall into two different areas, corporate providers and individual providers. And do they have a different perspective or a different need of what they're getting? And then our patients, what ultimately do they need to know? What kind of information do they need to have? And how do we get that information to them in a manner that's understandable so that they can make good decisions for themselves? Next slide. So if we look at the legal considerations, which between the ethical considerations and the patient considerations, we have this big array of legal considerations. So if we look at tort law, tort is usually defined as a wrong to a person by another person. Well, and then we have the court deciding how we're going to punish the one and reward the other. And negligence is a part of tort law, and product liability is a part of tort law. But if the wrong is done by a person, then how do we use AI? Because AI is a machine that learns from itself, that can, yes, we have the algorithms that are written, but who do we go after? And that is a huge problem. Next slide. So we have the tort law, and then we have product liability. And this is interesting because we want to look at if it's a tangible personal property, then we can go after it. AI doesn't really fall into that. And then we have the consumer protection. AI technology is usually not transparent. All of these companies want to try to keep it proprietary for a financial reason. So we have that to, contend with. And patients may suffer harm, but they don't really know what product was even used, like who wrote the algorithm that said that that lesion most likely is, a cancerous with a bad prognosis, fast aggressive cancer. They don't know that. Next, please. And then we have the contract. So again, contracts are usually between parties. Well, you can't really provide a contract with a machine. And so with the algorithms, it's again difficult, if not impossible to explain. And we have this black box that's in the middle of everything. So patients claim against the defendant, a doctor, a hospital, whatever, but is the black box part of the injury or is it the cause of the injury? So we have contract issues as well. Next. We have agency. Dr. Sambar was talking about that a little bit earlier. That governs relationships between parties. And so can a salesperson that's coming to your office or your business to sell you this product, are they adequately trained as a physician? And I can speak personally, we rely on these salespeople. They're trained. The same for pharmaceuticals. But is that really in the best interest of our patient? Next. And intellectual property, everybody wants to protect their investment. And there are some laws that say if it's for the better of humanity, they really can't withhold that information in a way. But we still have areas of intellectual property that are going to be protected. And it comes down to who's developing our algorithms and what are they being used for, who has access to them. Next. So what I would say is it's essential, but we have a lot of things that we need to address every single time we look at this. One of the things that comes up is how frequently do we need to change all this? So, you're a small practitioner out in the boondocks and you buy this practice management program, or you buy an x-ray machine, a cone beam machine, for example, that's $100,000. You're not thinking, oh, I'm going to have to replace this in 2 or 3 years because technology is going to be outdated. And yet that may be the consequence of your decision. So we have a lot of issues that we need to look at. And right now we're so in our infancy of AI and how it's going to play out. Yesterday, for all of you that don't follow the news because it's kind of depressing, there was a huge settlement, a large case, nothing to do with healthcare, but definitely involving AI. And then the individual in Northern Ireland was convicted using only computer sources to get to his prey. And individuals have committed suicide because of some of the things he was doing to sexually batter young children. So there are some very, very real implications of AI. And as a healthcare provider, we have to protect that as well. So I would, with that, end my time. Thank you very much. Any questions, you can please email me. This is not my primary area, but I am very interested in it because I have a vested interest in taking care of my patients. So thank you again.